As a PhD student, my research interests focus on understanding the neurocognitive and psychosocial factors underlying suicide in transgender young people. In the first year of my PhD program at The Ohio State College of Nursing, I took a course titled Philosophy of Science and Development of Nursing Knowledge with Dr. Beth Happ. In that course, we examined the historical, philosophical, and theoretical basis of nursing science. I became particularly interested in theory development and testing, which led to the initiation of this manuscript. In order to have sound theory driving our research, we must approach development with a balanced scientific scrutiny. Toward that end, and since the completion of the course, Dr. Happ and I have collaborated to further develop and refine the theory, evaluation, and analysis presented here. Suicide is a public health crisis in the U.S. and around the world. The phenomenon of suicide is complex, and despite decades of research, we have not yet established reliable explanations for this behavior, nor developed strategies to predict or prevent this fatal consequence. Research of the last decade or so has revealed a seemingly subtle but significant distinction between suicidal ideation, or thoughts about killing yourself, and the act of suicide. This distinction is known as the ideation to action framework, which emphasizes the factors contributing to those who have suicidal ideation without acting on it, and those who have suicidal ideation and act on suicide. The three-step theory of suicide proposed by Klonsky and May in 2015 is one of a few contemporary suicide theories that incorporates this framework. The theory puts forth three stepwise propositions. 1. Pain and hopelessness together lead to moderate suicidal ideation. 2. Pain and hopelessness that overwhelm connectedness escalate suicidal ideation from moderate to strong. And 3, suicide capacity contributes to if and when an individual will progress from strong suicidal ideation to suicide attempt. The image depicted here is an adaptation from Klonsky and May's original article, and creates some confusion with structural similarities more to a screening tool than a theoretical framework. However, this middle-range theory is a valuable contribution to the science of suicide, and demonstrates significant scope and context, as well as coherent content. Other strengths include structural consistency and parsimony. Importantly, the theory provides conceptual targets for potential suicide screening and prevention strategies. As you can see here, designing and investigating interventions targeted at suicide capacity, connectedness, pain, and hopelessness may be beneficial. In our critique, we suggest improving the conceptual clarity, particularly around levels of suicidal ideation, could better guide testability and enhance empirical adequacy. Though not yet robust, initial empirical evidence supports the merits of this theory, but further research is still needed. As nurses, we have a unique opportunity to be the most trusted profession, and often the one spending the most time with our patients. As such, I believe it is imperative that nursing science communicates the most accurate theoretical explanations for suicide. This knowledge can empower us to be agents of change in the trajectory of suicide through achieving more accurate risk assessment and intervention. Thank you for listening. We hope you enjoy the paper.